Let's start with Barbara. Are you working with her with IPS?
Yeah, I did a support visit at her place of employment at Walmart, and I know that Ginny is talking a lot with her about finally getting her into her own housing. She did seem a little stressed about it. I know that, you know, she hasn't been really open to medications, but I thought maybe you could, you know, maybe talk to her. What do you think, Ginny?
I think she was stressed because they were talking about her moving perhaps to New London instead of, and if you could maybe see about getting her a job in the New London Walmart instead of the Norwich Walmart, and if that took place, then perhaps she could move to New London because she could get housing in New London quicker than she could get housing in Norwich. She'd be on the waiting list for a long time. So she needs to talk to you about that, and I think that made her anxious.
Oh.
That makes sense because then she could work very close to where she lives. It would be easier for her to get back and forth to work, especially on bad days and days when transportation's a problem.
She does have a really good rapport with her bosses there, and I know she's comfortable, and I think maybe the change would be really positive for her. So I could talk to Elise over there, that's the manager, and see how they feel about it. She seemed open to that idea.
Well, she's, you know, Barbara, she's a little bit scared. It's a change. She doesn't do change well. But if she decides to do that, she can get into an apartment in a month, where if she waits to get an apartment in Norwich, it's going to take her at least 6 months to a year. So she knows that, but she's also like afraid of change. And
well, she is very familiar with Norwich. She was born and raised in Norwich, and she has been asking to get her own apartment and asking you to help her. So let's try to ask her how she feels about relocating. And you know what? She could probably get an apartment in Norwich very soon. She has a great history, no legal issues.
Good credit, she's held that job.
And she's still close to us, even though she really hasn't engaged with us very much for clinical services. You know, she hasn't agreed to take medications, and she's clinically stable without it. It's, you know, would she do a little better with medications? You know, maybe not. Or maybe, you know, to say you've done a great job, Mary, with helping her with her job at Walmart and how well she's been doing there, and you've always shown up. You've been there for her, so I congratulate you on your job that you've done.
Ginny's.
And all the whole team, of course.
I'd just like to say that supported employment is an essential piece of helping the individuals in our team. They start with employment, and it helps structure their day and carry them for the rest of their recovery, and moves them to a higher level where they have self-esteem and they have money in their pockets and they're feeling much better about themselves. And some of the old habits and things that weren't working so well for them now work around the piece of employment.
Supported employment services are provided through a team approach. When other professionals outside of the mental health agency are providing services, they become a part of the team. For example, the Department of Vocational Rehabilitation partners with mental health agencies to provide supported employment services. It is important for practitioners from each system to meet together to define their roles for collaborating and serve together. Some of the services provided by vocational rehabilitation include training, situational assessment, job shadowing, job-related equipment and supplies, tuition, placement, and support.